Hello and welcome. Good afternoon, panelists. If you wouldn't mind chiming in, just making sure my audio is okay. Thank you so much for being here. My name is Jeremiah Aha. I'm the Assistant Director for Wellness Together, School Mental Health, and we are thrilled that you are here and making this a part of your afternoon today. This is part 2 of a 3-part webinar series in partnership with the California Department of Education. It has been great working with them to host these for you, and we've really been blown away by the response. In fact, last count, it was over 8,000 registrations for this webinar, which has been jaw-dropping. At the same time, our team, along with CDE, is really, this has been evident to see the need for us to connect in this time, the need for us to depend on each other for support, and it's really been great to be a part of things. I'll be hosting us again for this time. If you were with us for part 1 last Thursday, welcome back. We're so glad that you're here with us again. If this is your first time here with us here for part 2, so glad you made this a part of your afternoon. You likely have a very hectic schedule in the midst of transition. If school closures have been around for about 5 weeks now. Thank you for your time here today. We are privileged to host you. And a few housekeeping things before we get started. Have a really exciting 2 hours to support you, supporting students. So let me go ahead and share my screen once again and go through 4 important links for you. This is probably 4 of the most important questions or the most requested questions that were asked last week. So here we go. I'm going to say these several times in case some of us join late this afternoon. But for any resources that the presenters are going to have, whether it be slides or supplemental materials, that's going to be in a bit.ly folder that's accessible for free to you. Just feel free to visit bit.ly and then just the name of the webinar series, Supporting You, Supporting Students. So at any point from now until forevermore, visit bit.ly/supporting you, supporting students to find all the slides, any of the PDFs that are referenced. The presenters are uploading their materials in there, so make sure to check that out. Secondly, for another important link is feedback. We want to hear from you, not just on how this webinar experience has been, but also what are some of your biggest needs? What are some of your biggest stressors? What are some of the biggest needs you're hearing from the students and families that you are serving? So feel free to visit wellnesstogether.org/feedback. And there's a quick form you can fill out there. We want to make this time very valuable for you. Also, really just kind of a moment where we were kind of taken back, where last week we opened up kind of the Q&A panel there at the bottom. And we had all attendees be able to ask questions. Well, it ended up being over 24 pages of questions for our team behind the scenes to filter through and everything. And so we want to have an opportunity to be able to capture those questions and organize them and present those to the speakers. So if you have a question for one of the panelists here today, I invite you to go to bit.ly/SYSS2020. And again, just think of the webinar series title, Supporting You, Supporting Students, SYSS 2020. So you have a question, we're going to have a little bit of time at the end, and our panelists are going to be here. There will be time that we have, and so feel free to submit your questions for the panelists or just general things for you. And lastly, another important link is these are being recorded, so feel free to tell your colleagues who may not have a chance to visit today. The fastest way to get those videos is by subscribing to our YouTube channel. Just go to youtube.com. I'm going to assume that there's familiarity with that, and search for Wellness Together and click subscribe. And so the moment our communications team uploads those videos, you'll get an alert showing that, and you'll be able to have that. If YouTube really isn't your thing, feel free to go to our website at wellnesstogether.org/events, and you'll be able to take a look at the video there. So those are kind of the housekeeping things. For those that are in need of closed captioning, just feel free to click the tab on the bottom if you haven't already. And thank you, Denise, for providing the closed captioning services for us all month. We're grateful for you. We're grateful that we can increase access to all those that would find this helpful. And so now I'll turn it over to the founder and executive director of Wellness Together School Mental Health, Marlon Morgan. Marlon?
All right. Thank you, Jeremiah. We hope we find you healthy and safe during this time. It's great to be here with all of you. I want to take a moment to thank our attendees, but also our partners in making all of this happen. We want to thank the California Department of Education, the Office of the Surgeon General, the USC Dvorak Peck School of Social Work, the California Association of School Counselors, Stanford University, and Stanford Center for Youth Mental Wellness and Wellbeing, Pacific Southwest MHTTC, the California Association of School Psychologists, the Children's Partnership, the University of Maryland, and the National Center for School Mental Health, and the San Joaquin Child Abuse Prevention Council. And again, especially all of you, the professionals that have joined us here today to continue to learn how to support your students and families that you serve during this time. Quick note, as we know, even before COVID-19, a lot of our students and families have been struggling with some negative impacts on their mental health. We've been seeing some themes in the research over the past 10 years. We often reference those as the 5 S's, that really work together to create a sense of isolation and negatively impact our students' mental health. The 5 S's we've talked about in the past are, our teens and our children are getting less sleep than ever before, which can negatively impact mental health. We know that. They're also experiencing and spending more time on screens over authentic relationships and connections. They're living more of a solitary and sedentary lifestyle, which sometimes can result in even self-medication. Now, we know about those 5 S's, and during this time, in addition to the trauma that we've all experienced in this crisis, we've added a 6th S, which is social distancing. And that has really contributed to the feelings of isolation amongst our students and families and amongst all of us as professionals. So we're really glad we can join here today and really help you to reconnect with students during this time to mitigate the effects of that 6th S, the social distancing, and really help students to remember that they have a connection to a structured environment and adults that they can rely on. So we're excited to welcome, especially excited to welcome today, the California State Superintendent of Public Instruction, Tony Thurmond, as well as Monica Nepomuceno from the California Department of Education. I want to say a few things about Monica. She's been a colleague and a friend of mine for years, a constant champion for students and families and advocating for their student mental health. Monica started her career as a social worker in the Galt Joint Union Elementary School District, where she spent 12 years serving students and families as an outreach consultant. She's been with the California Department of Education for 13 years, and 11 and a half of those years have been working in the mental health services program. Among other tasks, Monica chairs the Student Mental Health Policy Work Group, the SMHPW. She coordinates youth mental health first aid trainings and for LEAs, and is a YMHFA instructor herself. She is a YMHFA instructor herself and prides herself on building relationships with local and statewide national partners to bring much needed services to schools. I can attest to this. We've seen her build many coalitions and councils to really contribute to the access, awareness, and advocacy for student mental health. An example of this is in the recent development of the statewide crisis response team, or the SCRT, which is a part of the SMHPW mentioned earlier. And this has been a vision of Monica's for quite some time. The goal of the SCRT is to offer support and guidance to LEAs that have experienced a student suicide. And the team connects with the LEA to ensure that they are receiving timely and accurate information, identifying resources to fill in the gaps, and assisting with messaging to staff, parents, and students in their community, and helping them find ways to support those affected by the suicide. Please join me in welcoming Monica Nepomuceno.
Good afternoon. Can you all see me?
Sure can.
Okay. Well, I don't know what to say. That was a very humbling introduction. And for those of you who know me well, know that I don't like to be in the spotlight, but I couldn't deny the opportunity to address so many people, the masses, really. Thank you so much for taking the time to be here with us today. It is a great pleasure to know that there's such great interest in supporting our students' mental wellness as well as our own, and we shouldn't forget that part of it. I know that you've heard this before, that we're experiencing tough times. We're going to hear it over and over again because that's our reality. And to be totally transparent, no one really knows what the future is going to hold. We, hear all kinds of different things about how things are changing, how maybe school may not resume until 2020. We don't know. So let's not focus on the negative. Let's really try and focus on the positive. And although we want to envision that things will go back to quote unquote normal, we have to embrace the idea that our operational functioning will be very different from now on. This isn't meant to alarm anybody. I just want to remind you, that different and change is not always bad. So we have to find the helpers, we have to look for those helpers, and we have to find the silver lining. And my silver lining in all of this is that I can sit here with my slippers on and address all of you. So I think a lot of you might be able to relate to that. So just want to remind everybody that we really are at a pivotal point to step back and look at what we've been doing and how we've been operating, and find ways to improve the educational system. And, let's be honest, right? We've all thought of ways on how we can improve. So let's consider that. Let's give that some deep thought. And again, my friends, we are living in unprecedented times. Again, probably a cliche by now, but in line with that is unprecedented times call for unprecedented solutions. And just to remind us of the words of our governor, who is one of the nation's leader in the COVID journey, it's time for us to meet the moment and think outside the box. So today I invite you to extract as much information and usable strategies as possible from the presenters. I also invite you to take that extra step and invite your colleagues to do the same so that we can collectively improve the way we respond to our students' need, both academically and with their mental health. So just a little overview, as we did in last week's webinar, we're going to start by giving you a bird's eye view of what's going on at the statewide level, specifically the activities of the CDE to support all of you. And then you'll be learning specific strategies from our subject matter experts. With that all said, I want to introduce our state superintendent. It gives me great pleasure and an honor to introduce you to the 28th California State Superintendent of Public Instruction, Tony Thurmond. Superintendent Thurmond is an educator, a social worker, and you social workers know that once you're a social worker for life, right? He's also a public school parent, and he served the people of California for more than 10 years in elected office. Previously, Superintendent Thurmond served on the Richmond City Council, West Contra Costa Unified School Board, and in the California State Assembly representing District 15. It is my honor to work closely with someone who is so passionate about helping others in a time of need, such as what we're experiencing now. And he's definitely interested in moving the needle on student mental health. So please help me welcome Superintendent Tony Thurmond.
Good afternoon, and if it's okay with the host to be unmuted, I'd like to go ahead and begin. Thank you. Monica, thank you for the introduction. Thank you for your work. Thank you to our friends and partners at Wellness Together. Thank you, Jeremiah, and thank you, Marlon. And thank you for everyone who's participating in this panel. and who is participating in this work. And to the more than 8,000 folks who I know who've signed up and who are participating today, thank you for what you do for our 6 million students. I want to start by acknowledging the resolve and the resiliency of our students and their families, their educators, their advocates, and those who care for them. These are, as you heard Monica say, unprecedented times, but we are a resilient people. And I am encouraged by so many who do so many things, some large and some small, to support our ability to move forward, to endure and to move forward. And the only way that we move forward is together. And so I'm grateful to all of you. And my training as a social worker is to always think about how to be strength-based. And I want to acknowledge the resiliency of our students, our families, administrators, supporters, and those who care for them. I also just want to acknowledge that this is not easy. There is no clear blueprint for how to do this. And that even before the highest level of intensity with this pandemic had impacted our schools, our state, our nation, and our world, we were already having conversations about how to expand mental health services and supports for students and for many in our state. We had planned many new resources like community schools programs and more school-based mental health programs to support our students. And we know that now we find a question mark on how many of those programs might proceed, because literally many of our students and their families are trying to scramble for basic needs. And so I'm grateful for all of you. I'm grateful for our team at the California Department of Education that is working to help our 1,000 school districts with anything that you can imagine, from meal delivery to securing computers and mobile hotspots for students who don't have access to the internet, to providing training on how to provide distance learning and support to our educators. We know that there are just a tremendous amount of needs, and we want to continue our work to consider the needs of our students and their families as it relates to mental health. Many of you have reached out to me, and we have been in conversation together with the administration and with foundation leaders about how to support our mental health and our social services safety network. We know that we have to hold it together so that we can continue to provide support to our students. We know that literally many of our districts are experiencing circumstances where students have not checked in yet, have not been heard from, and we need to identify strategies to reach them. We know that this whole pandemic challenges everything that we know and forces us to think about how we deliver education through a distance or remote learning. And while there was already telehealth before the pandemic, it stretches us to think about how we deliver quality mental health through a remote or telehealth way. It is a challenge like none other that we have faced before. But as it relates to educating our students and providing the supports that they need, it is a challenge that we must and will rise to meet. We'll meet it together, and we'll meet it for our students. And so I'm grateful for all those practitioners, social workers, psychologists, school counselors, MFT, whatever your background or your orientation. What matters to me is that we're all coming together. I love this whole series of supporting you, supporting our students. I'm grateful for this partnership. I know that we have much work to do together, and just know that the California Department of Education is in this with you. We're in it to win it as it relates to providing all the supports we can for our students, their families, and those who care for them. Thank you very much, and together let's learn what we can, learn from each other, and enjoy today's webinar.
Superintendent Thurmond, thank you so much. We are in it to win it. You're right. We're here together. Thank you for your leadership. Thank you for leading the team that is resourcing all the educators, support staff, district leaders, administrators that are here with us today, all you serving mental health professionals. Thank you for the encouragement, and just to know that we are headed in a good direction. We'll continue to do so. For all of you that maybe have joined late or didn't get a chance to hear the welcome, I just again want to say thank you. You're likely at your kitchen table, or maybe you're on your couch, which is now turned into your new office, or maybe you're in the same room where you sleep, just 8 feet away, something like that. But thank you for being here with us, and whatever this kind of new normal looks like for you. It seems like anything but normal, right? But thank you for being here. And a few helpful things before we continue, before I introduce our next presenters. I just want to share a few helpful links with you. For those that heard this before, this is a reminder, but for those that came late, any resources today mentioned, including the slides, will be available at this bit.ly/supporting you, supporting students. Feel free to leave us feedback and ways that we can serve you better at wellnesstogether.org/feedback. If you have questions for panelists, if you have questions today in general to how to support students or how to support your staff during this time, feel free to visit bit.ly/SYSS2020, supporting you, supporting students acronym. And finally, all these recordings are going to be on our YouTube channel. Please just search for Wellness Together at YouTube and click subscribe. That's the fastest way to get to it, or we're going to have it there on our events page online at wellnesstogether.org/events. Okay, so let's continue moving here. I want to read just a couple of bios from our first presenters today. We're privileged to have them both with us. This is Pamela Vona, and she is the co-director of the Center for Safe and Resilient Schools and Workplaces. She's also the center manager and research associate at the Treatment and Services Adaptation Center for Resilience, Hope, and Wellness in Schools. Ms. Vona's interests include understanding how to support public and private organizations as they transition into trauma-informed systems of care. And she served as a lead developer for the Trauma-Responsive School Implementation Assessment. Now, this is an online assessment designed to help schools improve their trauma responsiveness. She's also the lead developer of the Trauma-Informed Skills for Educators. This is a curriculum designed to enhance educators' trauma knowledge and skills. She also serves on the school committee work group for the National Child Traumatic Stress Network, and previously was a member of the National Child Traumatic Stress Network Policy Task Force. Pamela, we're delighted to have you here with us. Thank you for your time. And she will be presenting alongside her colleague, Vivian Villaverde, and she's the Clinical Associate Professor in the Field Education Department of the University of Southern California School of Social Work. She graduated from Columbia University School of Social Work with a Master of Science degree in social work. She formerly worked as a psychiatric social worker within the Los Angeles Unified School District, specializing in collaborative program partnerships in LA County agencies, such as the Department of Probation, Department of Mental Health, Department of Children and Family Services to serve students in the foster care and the delinquency, where she gained significant subject matter experience in coordinated collaboration and capacity building. Professor Villaverde is the teaching institution coordinator responsible for developing large-scale community partnerships. In addition, she's a trauma-informed school support specialist for the Treatment Services and Adaptation Center for Resiliency, Hope, and Wellness in Schools. She collaborates and trains not only nationally, but internationally with schools, districts, and other organizations such as the CDE, the Northwest MHTTC, University of Washington, the Philippines Department of Education, and School Mental Health Resources and Research Center of South Korea. So again, Pamela and Vivian, thank you so much for your time. I'll turn it over to you for your presentation.
Thank you, Jeremiah. Happy to be here.
Good morning. Pamela will start for us.
Sure. And Vivian, if you want to pull up.
Oh, I need to share the.
Great. Thank you for having us today. Great. I'm so happy to see so many people doing, and all of us so committed to doing what we can to support our students during this time. So as Jeremiah mentioned, Vivian and I are both here from the Treatment and Services Adaptation Center for Resiliency, Hope, and Wellness in Schools. And our center is federally funded by SAMHSA. We're part of the National Child Traumatic Stress Network. And really, the mission of the center has been the same for 20 years. It is to develop and disseminate the highest quality, most effective interventions and resources to support our youth who have been exposed to trauma. And we'll be talking about the psychological first aid intervention developed by our center director, Dr. Marlene Wong. And we certainly have additional resources that can support our students weeks, months, and years out following all of the stress that we're under as a result of this pandemic. And I'll turn it over to Vivian.
Great. Good morning, everyone. Oh, wait, no, we're on good afternoon now. Time is blending for me as well as today. So I just wanted to double check. Pamela, can you see the PowerPoint? Perfect.
Yes, I can.
I see you. Okay, perfect. So what we're going to talk about today is, so my name is Vivian Villaverde, and I am a faculty at the USC Suzanne DeVore Peck School of Social Work, and I work with our students who are interning with the different partner organizations that we have. And also, I'm proud to say that by training, I am a school social worker, so I did not stray very far, although I am doing higher education now. I ended up gravitating to what I like, and so I continue to partner with different schools and school districts and bringing in the trauma perspective and consulting and supporting the trauma transformation at multiple levels. And so today we're going to talk about psychological first aid, and the psychological first aid that we're going to talk about is listen, protect, connect, model, and teach. And this is, I want to make sure that we're sourcing it. Dr. Marlene Wong is one of the co-developers of PFA LPC, and I am happy to say that this was definitely, I think, influenced by some of her work that was done with LA Unified School District. So we definitely are very much still active in supporting our schools and school districts. So we want to make sure to credit the model that we're using today. So why PFA? Why is it important? One of the reasons is where there's physical damage, there's definitely community disruption and emotional injury. And so what we want to do is make sure that we're providing the avenue or the venue to create a compassionate environment for everyone, assess what someone may need at that moment, and provide immediate support for those in stressful situations. So when we help others, we want to make sure that we're helping others cope in the face of the stressful events. And so most of the time, when there's a particular stressful event or a major disaster or anything like this, schools are sort of the epicenter, both becoming as a center for shelter or a quick response, or that's where families are mostly relying on in terms of making sure they're, sending their kids back to so that they can take care of all the other things that they need to do. Although that is the typical situation that we're used to, we are sort of in a different situation now because this is an extended stay at home. And so even though the students are in their homes, we are all still reaching out to them, and we're doing what we can to make sure that they feel connected, that there's a safe connection somewhere. And I think that's the adjustment that we need to look at. So the goals of PFA is to establish physical and emotional safety. And we now have to think of this with a different sort of medium in mind. We're doing this in a remote way now, whether it's virtual or telephone. How do we create that physical and emotional safety? So another thing that we want to do is stabilize emotions and behaviors. And again, we have to look at it from that point of view. How do we accomplish this in a remote way? Support the return to an improved mental and emotional state, ready to resume education, their respective roles, and re-engage in work and family life. So PFA is not only for the students, and it's also wonderful to use amongst our peers and our colleagues and each other. Because I think this is one thing to keep in mind too. Not only are our students and families a victim of the situation that we're in, all of us are too. So we have to look at that. And how do we provide support to each other and create that stabilization or that avenue of being able to connect? And so if we can remotely provide that safe safe sort of connection, then we potentially, want to make sure that when we resume and come back to the physical environment of the schools, that those connections are going to continue as well. I just want to quickly touch on this in terms of the psychological reactions to disaster, and I definitely wanted to credit Dr. Wong on this. She does this in her presentations, and she is in the audience today as far as I know. So this is the typical phase of disaster. And so usually, and I think you can look at, there is a pre-disaster phase, and this is when we're supposed to do our crisis planning, looking at all the different, sort of safety net and supports that we have. And then what happens is that there's an event. The event happens and things kind of, we have that momentary sort of activating all the processes, the responses that we have, and then experiencing that thing where it's a combination of different things. There might be some shock, there might be some immediate sort of getting together. But while that event, as soon as that event happens, there is a heroic phase where we get an overwhelming response of supports, of getting together, of mobilization. That's the word that I was looking for. And then there is that honeymoon stage where things are getting done, things are getting worked at, the supports are there. But then also, once sort of everybody starts going home and time is elapsing and everybody has to go back to the normal, there's a sense of disillusionment that happens. The people who are the typical victims of wherever the disaster is, we are now stuck with fending for ourselves, not completely, but we now face the picking up the pieces and reconstructing on our own, but also then we encounter some of the potential barriers to that reconstruction. And so that's where sort of the disillusionment comes from. And sometimes we then, because we're not as busy as that immediate after fact activities, that's when we start experiencing the losses and the grief and really the difficulties of picking that together. And then there might be some triggers along the way as you're engaging in that reconstruction, because those anniversaries. So where I wanted to point out on this one is that we are on an extended event and heroic stage. And so this is a different kind of phasing that, at least for myself, I have not encountered. So I want us to kind of look at this and put it into perspective as we do the work that we're doing. We are still in this event and heroic stage in combination. And so keep that in mind. And I think that is important in terms of context and looking at it. So I'm going to spend really a short time on this particular slide so that we can move on to the different skills. This is FEMA's recovery continuum. Just to kind of see, highlight a little bit what to expect. There will be that short-term, facing and journey that I talked about, but then there will be this intermediate one as well, which is weeks after, but again, there's that long-term part. But for us, for this particular situation, there's this constant overlapping. And so and again, another context to look at as we move forward with this. And so with that, just a little bit of some informational background, we're going to move ahead to our psychological first aid. And I will give it to Pamela Bona.
Thanks so much. So one of the first things as we start to engage in this process of trying to enhance a sense of physical and psychological safety for our students, their families, and one another is that we should be expecting a certain level of distress in terms of all of those that we're interacting with. And Vivian, you can put some of those examples up as you advance the slide. But these are the kinds of things we're going to be seeing not only in our students, but in families and even with the loved ones that we're all quarantined with at this time. And so the more we expect out of one another, even out of ourselves, the more we can create a sense of normality and then we can help people move out of these distress reactions. But we have to appreciate that all of these reactions are quite normal in the face of everything that we are experiencing. Next slide. And we do want to build upon coping strategies that exist. And so the more that we can identify healthy coping that people are engaging with and help them to do more of that positive coping, then we can create this sense of traumatic growth that can result from going through a very difficult situation, but acquiring a variety of coping strategies during that process. And we'll certainly towards the end be talking about how we have to take care of ourselves in order to do any of this work well. Next slide. Okay. And so quickly, as Vivian mentioned, this version of psychological first aid, Listen, Protect, Connect, is really an evidence-informed approach that resulted from many different disasters that were occurring on or near schools, including natural disasters, school shootings. And as Vivian mentioned, the primary goal of this is to understand an individual's immediate needs and to help address that immediate need and restore them to a place of physical and psychological well-being so that they can re-engage in the learning process. Next slide. Okay. And one of the things that I think is so great about this particular model is that it's really broken down into 5 concrete steps. And I think there's so much wisdom in that because we know as the helpers, we're all experiencing the same level of stress that many of our students are experiencing, whether it's due to the illness of a loved one, financial and economic distress resulting from everything that's going on. So we know when we're under stress, all of our best thinking can go out the window. And so by breaking it down into these concrete steps, we're really just simplifying it and we're identifying things that we know how to do well and just breaking it down into those 5 key elements. So I'll talk about the first 2 and then Vivian will take the others. So first and foremost, we need to listen. And part of listening is not making assumptions. We really want to be understanding what is particularly concerning for an individual in that moment. In other instances, a student may just want to tell you their experience, and the ability to lend an empathetic ear can help that student feel safe and connected during this unpredictable time. But we really want to be listening for what they need in the moment. And of course, that often involves too, some nonverbal cues if we're lucky enough to have them on Zoom, and trying to get a sense of where they are at in the moment.
Mm-hmm. I just wanted to add a little bit in terms of when we're talking about listening, really, if you're gonna connect with the kids, I know that we're juggling so many things, and this is something we bring up, is that are you able to really hear them and listen to them, or are you managing multiple things in front of you? It's easier to get distracted and looking at our mindfulness and our real 100% presence when we're remote, because they can't see, especially when it's phone. So if you're going to really connect and check in, I think looking at where can you do this, where you can be really present and really be there for the students at that, whether it's 5 minutes, 2 minutes, but managing that as well. Because I think is that there's that moment, there's a short window where if we're going to ask questions, but then if they're not really getting heard and they can sense that, then we might lose that in that first 60 seconds of that interaction. So I just want us to be really mindful of that.
Great. And then the second step is to protect. And again, that means helping individuals around you cope And that might mean providing reassurance, support, and encouragement. In other instances, that might mean pitching in where you can. So for example, we've talked about a lot of the different issues that are facing our students and families. Food insecurity, for example, is one. And so if there's information that we can provide to our students and families that can help address some of these immediate concerns, that's the way we pitch in and provide this level of protection to restore them to physical and a greater sense of physical and psychological safety. But we know that educators can't be expected to have every answer or every resource at their fingertips. And I think that's why the third step, connect, is such an important one.
Mm-hmm. And then to add a little bit to the protect, I just want you to think in terms of this could mean just for that particular student that you're reaching out to, to have somebody to talk to in that 1 minute that's just for them. Because at this moment in time, families are so stressed out that having you as that one-on-one where they can talk to you, that might be the nature of the protection that they need. And so as you listen to them, you'll get a better sense of how that particular student needs protection to be defined in that particular moment. And so as you do that individual protection. And then the third step is connect. Jeremiah and Marlon talked about this in terms of, and also one of the speakers, Mr. Thompson, last year, Dr. Tom talked about it last week, and he talked about what are those safety nets and resources and connections that you have in terms of when you're going to interact and check in with the students. Are you ready with potential basic resources, those 1-800 number for suicide, for crisis, a local food pantry? And so I will address this more towards the end because I have some guidance about it. But before you make that call, it might be a good idea to connect with your school district and with your school administrator. What is our crisis plan? Who's in our crisis plan? What is our safety net? And who are our partners in terms of resources? But again, all of us are impacted by this. We need to also, spend some time reconnecting with those partners for safety and resources because they might not be functioning as normal. And so we want to make sure that we're ready. So we want to encourage the interaction and activities with it. So one, there's multiple levels. You want to see who are the individuals around them that they are able to connect to when we're not on the phone with them. So I think this was a discussion last webinar as well in terms of what are the safety within the home. Is there a parent there? Is there grandma? Who are the people they trust most? Are they keeping connected? Are they keeping connected with their friends? So that's one level of it. Those personal protective resources and factors that you want to reestablish and really highlight for the students because you're not going to be with them on the phone 24/7. It's a check-in. And so the second component, the second layer of this are those additional resources. If they do let you know as you're listening and protecting, if they need additional resources or the family need additional resources. So who are those partners and how can we vet them at this moment in time? And I think the state and the counties that we all live in right now has been very, very good. I see it constantly on TV. I get emails about it as well. So modeling. This has a different meaning now that we're doing remote work and that we are connecting virtually as well as by telephone only. So how leveled is your voice? Are you maintaining that calm demeanor with the tone of your voice, speed of your speech? And are there side conversations that are happening without you being aware of it because you're also managing your own family and your personal responsibilities? So this is the kind of thing that we can make sure that we're very aware of as we making those check-ins. Take constructive actions, assure the individual's safety, even if that means that you're going to model for them what you do as soon as you wake up in the morning. I actually take a shower and I put on, I take off my sleeping clothes and I put on my work clothes or something that would give me that energy. So that could be part of that modeling, aside from the tone of your voice, and just giving tips to parents on what to do and how to really sort of create some sort of a scheduling and normalcy and an approach to all the stress that they're experiencing. And again, this is the part, I love this because my student actually shared this in the classroom. Right now, we are the peddlers of hope. And I just could not forget that. One of my students shared that today. The role of the social worker is, and what we do with our clients is we are peddlers of hope. And if that means that we can take it a day at a time, an hour at a time, that might be what they need in terms of what we could model for them. So what we want to model is the ability to just kind of cope with the day-to-day and with the minute details that might be happening right now. And the other ones are going to come. Again, because this is psychological first aid, we're looking at what's in front of us. So teach.
Vivian, I
sorry.
Point to
Sure.
model. And one of the analogies that I like to use for model is the idea of a flight attendant. And I know, as someone who doesn't love to fly, when I am on a plane that hits turbulence, you know, who's the first person that you look to? Well, often if you're anything like me, you look to the flight attendant. And if that person is calm and confident, that goes a very long way to reassuring me in that moment. And so I think the analogy is that we're all going through a turbulent time right now. And for our kids to have educators that show up every day with that same sense of calm and confidence can similarly go a long way to helping them have that sense of normalcy and safety that we're trying to restore them to.
Mm-hmm. Great, thank you, Pamela. So I love trading with Pamela because this is exactly what we do. We try to make sure that we cover everything as a team. So in terms of teach, something that we want to highlight, we don't have to think about that more complex level of teaching and psychoeducation. At this moment in time, again, this is psychological first aid. We're looking at some of the things as we listen and create that connection by providing, a safe and protective sort of environment, whether it's virtually. You can pick up on some of the things, some of the anxiety, some of the source of their worry. And if you can provide the, sort of short, swift, useful psychoeducation about physical changes, normalizing that, emotional changes, cognitive changes, maybe changes in their spiritual beliefs or changes in some of, the hopelessness that they might have and sourcing a connection to, again, peddling hope, whether it's connected to spirituality or not. And also those coping skills that are more in the immediate and as well as something that is easy to do. And then another thing is that problem solving. I want us to think of it from such a small scale versus the big scale. So the problem solving may be finding a quiet corner for the students for 1 minute each day, stepping out, just being outside the door of their house at that moment in time, whatever that is. And I've kind of demonstrated that earlier when I said, demonstrating to the students or sharing your problem solver, how do you pick up your energy in the morning? I shower every morning right now just because I need to wake up and I need to kind of make that transition. So my bathroom is my transition. I need to shower, change my shirt, and then I can start my day. So something like that. And you might have to do this for parents as well, because parents might be handling 5 students. And so how do we juggle all of that? So hopefully that's giving you some ideas of what teach could look like in this momentary time. Pamela, did you want to share something?
The only other thing that I would add is I believe that our colleagues from Wellness Together have done work with Dan Siegel, who I think is fantastic. And he has that phrase that I love called name it to tame it. And I think that's when we're teaching kids about common reactions to stress and what might be happening to them in terms of their ability to pay attention or how they're feeling emotionally. When we can help them name what's going on, then there's a greater sense of control and ability to manage it. So I really like this teach because it aligns with that name it to tame
Great. Okay, so again, to summarize or review, there are 5 steps to the psychological first aid. And again, this is pulling away from the therapeutic relationship if you are social workers, or your classroom relationships if you're an educator, and just utilizing psychological first aid for this moment when we're in the midst of this crisis. And so listen, protect, connect, model, and teach. And that's the kind of safety net that we want to provide, so that hopefully we can mitigate more serious impacts of trauma, or support those who are still working through some of the traumas that they're coming in with in our schools. And so what I wanted to do now is acknowledge Dr. Wong, Marlene Wong, in working with North American Center for Threat Assessment and Trauma Response, adapted the PFA Listen, Protect, Connect by developing some questions and sort of tips that are specific to the pandemic that we're experiencing, to COVID-19. So this is in the PowerPoint. This is going to be recorded, so you'll have access to it. There's also a link in Wellness Together's Google resource doc to the actual booklet and PowerPoint for the North American Center for Threat Assessment and Trauma Response, PFA, LPC. So listening, here are some questions. Tell me how you have been affected by the stay-at-home orders during the coronavirus. What's your schedule like Monday through Friday? How's your weekend? I'm ready to listen when you're ready to share. Again, opening it up, but not defining it, not assuming it, and letting them kind of direct the parameters that they want to discuss and that they might need protection with, connection with. And again, as you can see, you might have to make some adjustments on this, where if you're working with elementary school versus middle school versus high school, or with each other, with your colleagues at work. Because again, we are our biggest source of support right now, because we're all going through this. And I know I'm consulting constantly with my colleagues. So protect. Are you in a safe space? Are you safe with others? What are you most worried about? And with this protection part, you are, I think, with some of your remote contacts, whether you're support services or educator, I think this has been discussed. And so prioritizing that and looking at who can they call on to if they do need supports, and what is also your safety net if additional protection is needed that's outside of that call or remote contact. And then for connecting, have you ever had to confront a situation like this when you couldn't go outside your home when you wanted to? What can your family members do to help? So as you can see, there are more immediate connections that we can establish. Are they able to message with their friends? Do you facilitate, spend some time while you're doing your classroom connection with them, or your Zoom remote classroom, like maybe the 5 minutes, just reestablishing their connection with each other, doing something fun, because for the most part, your connection with them might be the most structured and stabilizing experience that they might have for that day, because there's so much chaos in the household because it's a full house. That's just the way it is for right now. What has been helpful for you in the past? This is really focusing on what have they done, really looking at their strengths. And Dr. Thurmond talked about being strengths-based. All of our kids have coping skills. And so how can we pull them out of them, and how can we remind them that they can utilize those skills that they use on a regular basis in this crisis as well? So it might be those kinds of things. And you know your kids the most. So you can tap into your knowledge of your kids so that you can highlight the strengths and resources that they might have. And then modeling, thank you for the courage you've shown, really verbalizing, and I think the labeling of it, like just what Pamela said, naming it to tame it is really, really helpful. Let's talk about some of the things you can do to reconnect with your family. And sometimes you might have to share with them that I text with my family a lot. I text with my friends a lot. So using yourself as a model for it, okay? And then you can also brainstorm with them, with students, with adults likewise. And then last, what you experience is very stressful, and then teaching them that all of us are going through this, and it's not something that is normal, but it is something that we're learning to cope with. And again, with the teach, I'm not going to read this because it's going to be available to you, but we might have to move away from thinking about more complex stuff, but you know, just teaching some of the more, I have ups and downs. Sometimes I cannot sit still and I have to get up because I sit still in front of the computer all day. And so sometimes I would talk about that and I would normalize that. I just need to move around sometimes. And then sometimes I just cannot stop looking and I have to set limits for myself. I need to get up as well. Okay. So just know that there are people out there who care about you, and this is the most important thing, and that's why PFA is really useful, that letting them know that somebody is there for them, and that if they need to talk, that, you know, whether it's a scheduled one or there's a way for them to notify that they need to talk to you, or giving them those resources that I talked about earlier. So I want you to really look, you know, and one of the things is that being that peddler of hope, I really look forward to the time when we will all return to school and take good care, you know, and then we want them to really take care. And we are looking forward to seeing them again physically. Okay. I will talk about the safety net later, but I wanted to hand it over to Pamela because we're going to talk a little bit about taking care of ourselves too.
Yeah, and we'll just go through this really quickly because I think we're running out of time on our side. So here's, you know, our center does a lot of work around this concept of secondary traumatic stress. And that really means what is the effect on our teachers of working with students who have been exposed to trauma and are retelling their stories to you. We know that our empathetic teachers often take that home with them and develop their own trauma as a result. But what's happening right now is we're all in this together, right? So our educators are not just experiencing the secondary traumatic stress as a result of what might be happening in their students' homes, but our educators have their own primary stressors, this transition to virtual learning, and maybe it's concern about someone else's health in the family, these financial stressors, developing a new life balance. This is what our educators are up against right now, and we need to be as mindful as possible of putting our educators' well-being first. And I guess I'm full of airplane analogies today because we've heard it a million times, but you cannot put someone else's oxygen mask on until you put your own on first. And so we're here to really advocate for the wellness of our educators right now. Next slide.
It's coming, sorry.
So really what we encourage you to do is think about these 6 domains of your life and how are you attending to them and what are you doing to enhance your own well-being around all of these different domains in your lives. And again, this is it's very much in parallel to what we're encouraging our students to do is implement PFA. It's, have you found a routine for yourself? Are you engaging in practices like mindfulness? Are there sources of support like your faith-based organizations that you're connecting with? All of the same things you're conveying to your students, you need to be doing for yourself. Next slide. And in order to do that effectively, we really need to identify what are the things that make it hard for us to engage in self-care. As educators, you're all used to putting everyone else first, but that has to change if we're going to be supporting our students effectively during this time. And then time barriers are often a challenge, but there's things that we can do to facilitate engaging in these self-care practices. And these are maybe creating a contract with another colleague or a loved one. Are you guys using Zoom to create some sense of virtual support for one another as we're all going through this? And then of course, being realistic with your goals and being kind and compassionate to yourself in the process. Thank you.
Mm-hmm. So I saw some of the questions here in terms of what can we do now. Oh, sorry.
Just real quick, sorry to interrupt. Just want to give just a 3-minute warning real quick. So glad these slides are going to be available in the resource folder afterwards. Just want to just jump in real quick just for a 3-minute warning. Let's get back to it.
Okay, thank you so much. Actually, this is perfect timing.
Awesome. There we go. We're in sync.
I saw the questions in terms of what do we do. I think the first step is like reaching out to your district and your administrators. What is your safety plan for your district? And is there a conversion of that safety plan for your local schools? And that's one thing. PFA is not an independent, sort of resource or intervention its own. It should be embedded in your school safety plan or crisis response plan, whatever you call it in your schools or in your district, because different ones. And so what I put up here is an example. LA Unified has this tooling. They have their crisis response guide. It's a PowerPoint and how they do that, and it encompasses all the different situations, including suicide, and then assessment. And then this is a resource guide, the second one, the second link. It is their web page for it. You don't have to have the web page, but a safety plan and a crisis plan is a living document. It should be where everybody knows where it is, and everybody needs to know what it is and what needs to happen or how it is activated. And so really it should be every employee must have an understanding of the safety plan for your own school. So that's where I would recommend in regards to the question that I'm seeing here, really looking at that and really making sure that every year it is reviewed, checked, as well as everybody needs to have that sort of walk through that crisis plan. And then the California Department of Education has resources as well. It's here. The U.S. Department of Education is here as well. But my last slide is giving you this. And this is sourced from Anaheim Union High School District. We partner with so many school districts nationally and locally. And so this is what I got from them. For this moment in time, this is what is important. And so they're not going to give all this, complicated and layered websites. So what they did, we're available from this time to this time. And for food distribution, this is where you could find the information. And then they have a web page for other family resources, and so it's there. But then they're not available. So they want to make sure that everybody understands that they can call 911, but then they also have this national crisis and hotlines that they can utilize as they go with that. So with that, hopefully it was helpful, and we gave you, sort of useful information and skills and questions to use. And I'm not sure if Jeremiah wants us to answer the questions later along with the group. So they're kind of thematic. It's about the same, so.
Yeah, we'll actually have some time at the end after all the presentations.
Thank you.
Yes, thank you both, Pamela and Vivian, for sharing this. I love the sample communication at the end. That'll be very helpful. I think one of the most validating things that I heard you all present was the fact that we're not only trying to support students or to teach or to lead our team in the midst of this crisis, so kind of vicarious trauma, but also our primary stressors, because we could be now taking care of an aging loved one, or now we're, with someone else trying to teach our own children, for the parents that are out there, or the other things that can kind of throw us off and stressors for us. So not only is this great information for our students, but even for us as well, because we're working through grief as well. I'm sure there are plenty on here that would have loved to gone to a graduation for the student and family that they've been with for several years. I mean, those are very disappointing things. So thank you both very much for being here. And then at the end, we'll kind of have you back. And some questions have been coming through quite a bit already. So we'll have time to take a look at those. All right, let me share my screen here. Thank you for all those that maybe have joined with us after we began at 1 o'clock. Just want to share with you some important links and something our team has caught, very thankful. We have almost a dozen people kind of in the background filtering through everything and putting the links here, especially within the chat. Zoom, at least at this point, doesn't allow us to copy and paste within the chat. So one way to do that, I think there was some instructions left on the chat there that was sent out to all of you. So I'll leave this slide up for a little bit. Might be helpful to put this into some of your tabs on a browser because I know it's not clickable at this point on your screen, unfortunately. But just open up some tabs. Some questions have been rolling in. Thank you for your engagement. We'll get to those afterwards. We're kind of going through those and finding some common themes. So for resources, as these slides will be in there, bit.ly/, the name of the webinar, supporting you, supporting students. For any feedback, wellnesstogether.org/feedback, not only on how this experience has been for you, but also ways that we can better support you and we can better support each other during this time. For questions for panelists, continue to submit those as we're about to have presenter number 2, Cassie Lowe, will be joining us. And you can ask questions at bit.ly/SYSS2020. That's just the acronym of the webinar series title. And then finally, these are being recorded. Part 1 is already up on our YouTube channel as well as our website. Fastest way is to subscribe to our YouTube channel at Wellness Together, or there on the events page at our website, wellnesstogether.org/events. So check it out there. We were delighted to have Deputy Superintendent Jackson with us, as well as the California Surgeon General Burke Harris join us, and all the presenters that were there with us as well. So if you missed that, definitely make sure to check it out. Okay, at this time, I'm going to introduce our second presenter, and we're very lucky to have her here. This is Cassie Lowe, and she holds a bachelor's degree in child development from Sac State. Stingers up. It's awesome. And a master's degree in counseling from St. Mary's College. She's passionate about trauma-informed services and impacting both the early childhood education and the mental health systems. She's a strong advocate for children's welfare and safety and has focused much of her clinical work as a therapist on healthy parent-child relationships and attachments. As a therapist, her clinical specialty is working with children 0 to 5 that have experienced trauma, abuse, and neglect. She's been with the San Joaquin County Child Abuse Prevention Council since 2013. She became the clinical director in 2014, and now she's responsible for the launch and the oversight. It's already happened for many programs, including school-based mental health services, early intervention mental health programs, transitional age youth mentoring programs, and clinic-based mental health services focusing on parent-child interactions. And just last year in February, she became the program director to expand her oversight to 23 early childhood locations and a variety of family strengthening social service programs focused on strengthening families. Cassie, thank you so much for your time. It's a privilege to have you with us. You'll be sharing some great resources. And now I'll turn it over to you.
Hi, Jeremiah. Thanks for the introduction. Hi, everybody. I'm so glad to be here with you today. And just as many people have acknowledged, I too just want to acknowledge the really hard work that you all are putting in. I don't think any of us could have prepared for the extra hard work that is working from our living rooms, but it has proven to be really difficult. And so I just really want to acknowledge all of you because you are totally on the front lines doing this really incredible work. And it does not go unnoticed. And I am sure that the children the students that you serve are appreciating it, whether they know it or not yet. Monica had reached out to me and asked me to provide some tips from a child welfare lens on how to check in with students and ensure their safety. The last 2 presenters did a really awesome job on kind of managing psychological safety. And I'll talk a little bit too on emotional wellness and just mental wellness. But also I'm just going to give you some quick tips on how you can engage families and your students while you're checking in with them to assess their physical safety as well. So Monica, I think you have my slides.
I'll go ahead, Cassie, and share them with you. You just let me know when you want me to advance.
Okay, awesome.
And we'll be a team here.
Yeah, okay, perfect. Thanks, Jeremiah. So you guys, this is a very quick tips edition because we have limited time, and I'm sure you could appreciate that we could go on and on for a really long time about how to do this from from a distance with our students and our kiddos. So these are very, very quick tips. And you'll see my email here at the bottom and then again at the very end. So I am happy to field all of your questions as we get through this if we don't have time for them today. So Jeremiah, the next slide. This is really the very brief recap. So if you are sharing this information with your colleagues or your network in some capacity, this is really the slide that kind of recaps the next few ones that we'll talk about. But just really acknowledging that from a child welfare perspective, educators play a critical role in keeping children safe. They spend a majority of their day with you. You've got your eyes on them. You are listening to the things that they are sharing with you. And all of that really is so critical in helping to keep children safe, both physically and mentally, of course, because we hear all the things that they're telling us. We see them coming in, look how they appear, what they're wearing, if there are signs of abuse or neglect that are happening. And because they're not in school with you, we recognize very much that the likelihood that they are experiencing those things and no one is noticing is significantly increased. Additionally, research tells us very clearly that child abuse rates increase during times of stress. And it is no secret that unfortunately the COVID-19 is wreaking havoc across households in America. And those stress levels are really rising, and families, not all families are equipped to handle that. In fact, many well-resourced families are identifying very clear struggles in keeping it all together. So we just really want to recognize that that's critical, because as you guys are doing your work and engaging with your students and families, we don't want you to forget that your role is still very critical in keeping your eyes and your ears on those families. And you likely already know this too, but school staff are some of the primary reporters of suspected child abuse and neglect for all of the reasons that we just went over before. You spend the most time with them. They tend to share a lot of things with you through their work or just through their relationships with you. And so we want to acknowledge that relationship is still so valuable, and you absolutely can still have a role in keeping kiddos safe. Many of you have been out of school for, well, we've kind of all been out of school for different amounts of time, but you've likely been thinking about some of your high-risk kiddos that you knew when all of this was going down, that you sort of had your risk radar, your risk antenna up for even higher. And so don't for a second believe that just because we can't be with them physically that we cannot support them. So we'll go through these kind of things, or these strategies to help get you there. The quick tip summary is the 3 I's: visualize, normalize, and prioritize are the 3 things that we're going to talk about very quickly. Again, this is super quick tips version, and I'm happy to be helpful to you beyond this webinar if you decide that you need that. And then the important resources as you kind of engage with your families and your students in this way is to absolutely make sure you know your local DCFS phone number, the Department of Children and Family Services, Human Services Agency, sort of whoever oversees for your area child welfare, so that you know where to make your mandated reports as appropriate. Local 211 resources are so valuable in providing basic case management information to families, because when they are stressed out, they are not making the best decisions, as we heard in our previous presentation. And so they might not be able to quickly tap into where to find helpful resources that help them to get their basic needs met, lower the stress, and then ultimately mitigate the likelihood of abuse or neglect. And then finally, you'll just want to make sure that you're really well aware of national and also local hotlines if there are those set up in your area. I always tend to put the suicide prevention one up here because hopefully this is just a number that folks can rattle off, because it's not a number that you want to be trying to hunt down in the middle of a crisis phone call with a kiddo. You want to know this phone number pretty well. So I've got it up there, but definitely take some time as you begin to engage with your families and your students. What are these kind of local resources so that you can tap into them as appropriate. Next slide. Okay, so the first quick tip was to visualize. While we are doing distance learning and we're not in a classroom or in a physical space with children, we really recommend a best practice of maintaining visual contact with children and families whenever, however you can. So there are, of course, many electronic platforms, just like the one that we're using today, Zoom, and other sort of just like electronic strategies that you can use to achieve this, using Skype, FaceTime. Microsoft Teams has its own sort of equivalent platform. But really the goal here is to have eyes and have ears still on your students and still on your families. For much younger kiddos, you can encourage them to share their home with you. I've been on a call with a few kids and they just love to give a tour of their house and show me all the fun things that they love to do and where they spend their time. Older adolescents can be a little bit more tricky in this way because they're probably just annoyed that you're calling in the first place. But just remember to sort of tap into the connection that you have with them, because again, just because you're not physically together doesn't mean that you can't connect with them. And we heard some great strategies for that too in our last presentation. But for older adolescents, you might ask things like, you know, where do you go to just check out from your family? Where do you go when you want to call your friends? Like, show me your space. And as much as you were able to sort of get the whole family on a call, that of course also is a best practice. Again, the goal here, the tip is really just to keep eyes on this family. As they're kind of showing you around, you can sort of assess what's happening in the home, who's there, what do the needs seem to be, and then just expressing curiosity along the way as you're seeing things and as students are sharing things with you. Next slide. So the next quick tip is to normalize, and this is really, from a child welfare perspective, we recognize that families are not necessarily going to always tell us that they are stressed out and that they are that they have thought about some of the most harmful strategies for managing their stress. So a best practice here is just to acknowledge that this is absolutely a very stressful time, and just to create a space for them where you sort of open up that is okay and that is real for so many of us. If you feel like it's appropriate or helpful to share about your own personal experiences with good kind of boundaries and filtering, and making sure that it's purposeful, then you can do that if that helps kind of create some connection with the families that you're working with. But if we sort of acknowledge that they might not tell us first that things are very hard, then we want to create a space for them and just say, oh my gosh, can you believe it? This has been such a wild ride. How are you guys managing? Listening to along the way for flat or somber affect in their tone. And as you're hearing them, expressing curiosity and care so that you can, again, continue just to create that space and let them know that you are here for them, you're recognizing what is happening, and addressing sort of discrepancies, right? They say, oh, we're fine, but it sounds really flat and sort of disengaged. You can address that discrepancy with them and just encourage the conversation. Asking open-ended questions to assess the family's functioning and needs is really critical here. When we talk about open-ended questions, of course, these are questions that would not likely result in a yes or no answer. But things like, what has been something new you've learned about your family during this time? That's sort of a general sort of assessment question that could give you some good information. They might share a story with you. So that's a very helpful question. Other ones might be, what is something fun you've enjoyed doing together? What are some challenges your family has faced so far, and how have you responded to them? Really, the idea here is that you want to both normalize that this is really hard, and then engage them in conversation about, but how are you getting through it, right? Tell me because I care. Tell me because I'm here to be helpful to you. I am a partner to you in this entire effort. Yes, I'm your teacher, but first, like, I am a helper to you, and so let me do that however you can. So these open-ended questions are really just meant to sort of assess, again, the family's functioning, and then you can assess too for their needs and protective factors. So what basic necessities might you be worrying about? Are you still working? Does the family, if the family doesn't have access to their basic needs, the original intention of your phone call, which was likely to sort of talk about schoolwork, is not going to be first on their radar. So you've got to get kind of a good lay of the land, so to speak, about what's the landscape like in their home right now? What are they worrying about? Do they know where to get their necessities from? If there's not a need now, but there becomes a need later, do they know how to address that need? How are they maintaining contact with family or friends? All of these are sort of different examples of how to assess the protective factors that we know when they are in place, when families know how to get their needs met and how to manage their stress, will mitigate the likelihood of abuse or neglect for the children in the home. Next slide. Okay, and then finally, the last quick tip is really to prioritize. So remembering that relationships come first, the relationship between you and that student, between you and the family, and ultimately the relationship among the family has to come first. If there is just stress and chaos and everyone is mad at each other and no one is communicating effectively, no learning will happen. For those of you who engage in trauma-informed classroom strategies, trauma-informed care, trauma-informed education trainings, things like that, you'll know what I mean then when I say that survival brain trumps the learning brain. So going back to sort of those assessment questions, what does the family need? What are their stressors right now? If they are stressed out, if there is so much chaos around, oh my gosh, how are we going to get food on the table? Are we going to be able to stay where we live? All of those sort of basic needs, if those are a primary stressor and are not resolved, learning cannot happen, will not happen. And the best thing that you can do from a best practice perspective when you're engaging your families from a distance is to make sure that they understand that you know that those things have to come first too, and that if they need help accessing those things, that you can be a partner to them in that way. Along the way too, and with that in mind, sometimes we just need to give families permission to take a break from schoolwork and focus on each other. If in your assessment conversation, they are giving you no indicators that they are enjoying their time together, that they're spending time together, that they are doing things that build memories, because they are so stressed out and overwhelmed by the circumstances, give them a break. There is no learning that can happen. There is no value to just sort of piling on one extra set of things. And I know we all have different priorities in this way, but from a child welfare, family safety perspective, this is just a strategy, not the strategy, but just a strategy when you're working with folks that are telling you that they're very overwhelmed. And then finally, ensuring that they know how to access the local resources. Again, this is why some of the pre-planning is so critical for yourself, so that when they're saying, oh my gosh, like we don't have food, you know where the local food pantry is, you know how to access that for them, so that you can really optimize your time on the phone with them. Recognizing that there may not be another phone call, because if they don't get what they need from you this time, this way, they might not bother the next time. So those are really the 3 quick tips, you guys. Again, just to recap, they are to visualize, normalize, and prioritize. And of course, along the way, whenever your gut says, gosh, something is not right here, whether you felt it before when they were in your classroom or not. Last slide, Jeremiah. Thank you. It's just a reminder that, of course, if you suspect any kind of abuse, to absolutely report it, and to just make sure that you know where to do that. If you're not sure about something, you can always contact your local Child Protective Services agency and just run it by the callers. They get a lot of those phone calls every day from mandated reporters or just concerned members of the public questioning, is this reportable? Should I do something about this? I'm worried, but I'm not sure I have all of the pieces. But if you suspect it, just remember your job is not to investigate, but just to let the authorities know so that they can do their job and support you in supporting families to make sure that they are well and that they are safe.
Cassie, thank you very much. Really appreciate it. I love the combination and the intersection of just practical resources and things that the attendees can do to help serve students and get them to safety, or to get some of those basic needs met, while also giving some some clinical support for those of us that maybe in the credentialing process or in our training haven't had formalized mental health training. So thank you for helping us take a look at that. And there's some questions been coming through. So I invite you to take a look at your email, as well as Vivian and Pamela. Take a look at your email as we're filtering those into you, just to okay those. But thanks again for your time, Cassie. We certainly appreciate it, and look forward to afterwards on the panel Q&A.
All right, thank you.
Very welcome. So again, I will share my screen to share a few quick links for us. And then introduce our final presenter. So if you joined us late, all resources can be found at bit.ly/supporting you, supporting students. All the presentations and things in here, there'll be clickable PDFs in there so you can access these very helpful resources from our presenters today. Feedback for not only this webinar, but also for ways that we can better support you or help you support your students. wellnesstogether.org/feedback. And then to submit questions to panelists, maybe go ahead and put in the tab, open a new tab in your browser right now or on another device, bit.ly/SYSS2020 to submit a question. And this will be uploaded before next Thursday for part 2. Part 1's already uploaded on our YouTube channel. Just search for that. Quickest way is to subscribe. You get an email alert immediately. Won't have to go to another website or remember where can I find that. It'll be delivered right to you. A notification, that is, or you can go to our website, wellnesstogether.org/events. So it is my privilege to introduce our last presenter here. Loretta Whitson is the Executive Director for the California Association of School Counselors. And it's a privilege to have her here with us. She's devoted her life's work to advancing the school counseling profession in California. She works closely with state leaders, legislators, and journalists, clarifying complex educational issues, and champions policies and practices to support school counselors all throughout the state. For over 20 years, Dr. Whitson was the Director of Student Support Services in Monrovia, USD, where she oversaw school counseling, as well as several district-level operations. Between 2015 and 2017, Dr. Whitson served as a chair of educational counseling program for the University of La Verne and was a visiting professor for 10 years at California State University, Northridge. Again, Loretta, thank you for your time. I'll turn it over to you.
Thank you, everyone. I'm so glad to be here. Let me pull up my screen and see if we have it here. Let's see. Slideshow. Can everyone see this?
Let me see what I can do on my end. Here, and if you're okay with it, Loretta, I can present from here if you want to just have me advance the slides.
Oh yeah, that's sure,
Okay.
that's fine. So anyway, I just want to thank, you know what, rock stars, Pamela and Vivian and Cassie. It's wonderful. And again, thank you to Wellness Together, Marlon and Jeremiah. That's absolutely what you're doing for all of us is phenomenal. So, and Tony too. I mean, it's just been a great webinar, and I'm so glad to be at the, I guess, the end part, which I think of myself more as a crossroads. And what I'm going to share today is going to be reflective of some real rock stars out there in the school counseling profession that have been working very hard to make sure that we are doing things we can for mental health in our schools and for our profession. So very excited to do that, and very appreciative of all the partnerships that have been working with the California Association of School Counselors for a number of years. Just a little plug is our association, CASC, is the largest state association in the nation representing school counselors. We are also the newest. We've been around for 20 years now, and it's quite exciting to have the group of school counselors from California working together. So we have been working for a number of years with the ACLU, public advocates, the Pupil Service Coalition. I just wanted to give a shout out to them. That's a group of individuals that represent school psychologists, social workers, nurses, the teachers union. So it's fantastic. So they are, they work and meet monthly to look into issues that are important to the school counseling profession and to all the pupil services and mental health services. So thank you again for allowing me to be here. And it looks like my, am I advancing? My screen is just a little bit interesting here, but I'm looking at the topic area, Jeremiah.
So I've been advancing, and I have it on the second slide, the grateful for these valuable partnerships.
Okay, if you can advance it to the next one, please.
Sure can.
So the topic areas that I'm going to address a bit, and I'm going to be very brief with mine. So like I said, I'm like a guide here with some things that's going to, what I believe is going to really help you, because it's going to be very resourceful. So I want to just touch a bit on some needs assessments that's been out there and some raising of some awarenesses that we're looking at. I know that that's been covered earlier on in this presentation, so I'll be very brief on that. Also, the resources that have been created, I'm going to be sharing, and then professional development and networking opportunities. So if you can advance that, please. So I'm seeing how to and the needs, and if you can advance it one more for me, please.
So the statewide community needs assessment slide is up now.
Okay, thank you.
Mm-hmm.
This has actually been part of the partnership with ACLU and public advocates, and we've been doing some needs assessments to see what actually are the needs that are going on out there. And so if you'll see that we have just what was mentioned, you know, mental health support, belonging, real uncertainty for our high school seniors and juniors, equitable learning opportunities is an issue, and engaging in students and families as partners. How do we do that? All the educational pieces to it. And then what are our students saying? So if you can advance the next slide, please. And so as you'll see, you know, these are what our students are saying, the stress and others, stress, harm to Asian Pacific Islander families. You know, there's just, it's a lot for us as mental health service providers to consider. If you can go on, please, because this has been covered. So this was a very interesting recent survey, and if I'll just point you down to the bottom frame, which says California teachers report a 20 to 30% attendance rate in their classrooms. So that's mind-boggling, and it's really an issue that we need to work on and see what we can do. Even though we've switched to a pass-fail model, you know, there's been a lot of things that I really applaud California for doing in regards to college and career admissions and some other kinds of things that we're looking at to help. It's still getting kids to a classroom setting to continue to have them learning, and then the discrepancy between those that don't have internet access or even equipment to go on the internet, and just getting kids to the classroom so that they continue to learn. Good. If you can go forward, please. So anyway, I love this little example here of some of the things that we are seeing in regards to the issues, and that's been covered, so I'm going to move on just because of lack of time. Now, I want to focus in on this a little bit because this is what this is Student Mental Health Week. This is something we've been working on for some time with Assemblymember Lowe's office, and whether or not the legislators meet again between now and May 4th is questionable. However, we are moving forward to draw attention to Student Mental Health Week for the first time in California. We wanted to focus in on May because that is Mental Health Month. And we wanted to make sure that not only are we doing things in regards to lessons and bringing awareness, but also doing some partnerships with op-ed pieces in some of the major newspapers and other media broadcast areas. See, we have 4 themes for that week, and all that's going to be accessible to you. So it's going to be very easy for you to be able to see and be able to access the information and be able to do some things with your students. So first one is just the reducing stigma. And the second one is trauma and grief process. The third is just the top 5 mental health issues for youth. And last is suicide awareness and prevention. And again, you'll see more about that. And I'm going to show you in the next few slides how you can access this information easily. This is our CAS webpage. It's always a go-to page for a lot of information. And if you just click on, this is all linked, so you'll have access to this PowerPoint and you'll be able to link on to our pages and other things. But over the last few years, we've been building access to a lot of resources. One of them is the best practices, but we also have video, we have podcast and webinar links, we have interactive maps, and again, we're going to be advertising and helping you out with Student Mental Health Week. If you can just move into the next slide, please. But I do want to spend a minute on the best practice document. It's a 10-page document. We have ordered enough for our superintendents in particular, and many of our superintendents across California has this document. We have organized the information around 9 essential points that are related to the local control accountability plan, as you can see it to the left of the screen. These are for you as you advocate. Let me put it this way, because I know some of you have reached out to me and said, I'm advocating with my administrators to do the work that I know is important right now, but it's been very difficult. And that's not in all cases, but in some, maybe even many cases, it has been an issue. And so this is a document that you can use and you can link and download in regards to advocating for the work you do. And other things is that it shows the educational code that references school counselors and other kinds of work. So please feel free to use that. If you have superintendents that you want to pass this on to, email me. I'll have my staff go ahead and mail out a packet for you so you can give it to your administrators. If you can advance on for me, please. The other thing, and this is an interesting development that happened, is that After probably the first week of school closures, I began speaking to other executive directors across the nation about what the needs are in our prospective fields. And we agreed that it was really more of a marathon than a sprint, and that we needed to approach it as if we were in for the long haul and make sure we have all the resources that we need. And so out of this, and this was a partnership with Wisconsin and California, we began to create a website. And I went ahead because I know some of you are like me and you screenshot things. And so I have it there so you can screenshot and look at it. I've had staff that was really working very hard to move this forward relatively quickly. We have 50 people plus others that worked on this website. So within the beginning aspects of this, when it was an idea, to today has been 2 weeks. And we have put together a whole website for you. It's not quite complete, but it's nearly completed. And so that's just a phenomenal task. And I just think that there's incredible people out there that are working very hard to actually vet information, consolidate information, making it a one-stop shop for all of you, so that you can reference in any kind of way that you need. So if you can move forward, please. These are the web pages that we have so far, and those you can drill down on, but we tried to come up with the ones that we thought were the most important. I'm going to show you just a little snippet of mental health and the caregiver resources and the administrative resources for you right now. If you can move forward for me, please. So here's mental health. And you'll see these are the 6 areas, and if you click on any of these areas, it gets into information for you. You can click on for me, please. And you see the caregiver resources. What we wanted to is, you know, we're also navigating and trying to show resources for our families like social services and where they link on. A lot of our families have never had to file for unemployment and or any kind of support. So this was one of the things that we wanted our families to be able to reach out to. We also wanted our parents and caregivers to be able to understand about mental illness or mental issues and be able to know where to reach out also. So that's in this page. And if you can move forward again, then you can see the administrative section, which is trying to answer some of the questions. So if some of the counselors or other pupil services providers that are out there are wanting to point your administrator to this page, it really talks about our roles and about how to support families and some of the things that are of interest to us. So we think this is a dynamic site and it will continue on for a while, we're sure. So if you can move on to the next one. We have this.
Real quick, Loretta, sorry to interrupt. So glad this is going to be available for all of us. Kind of feel like this is a behind the scenes unveiling of this site. So thank you. Just about 2 minutes left, 2-minute warning for you.
Thank you so much. So you'll see here's some speaker information, and probably the one that's the go-to, if you can move that forward, Jeremiah, is this one here with Rebecca and Beatrice, who put together, to me, a go-to webinar on everything you need to know about everything that you need to use. So if you can move on, I just did a clip. There's also PDF of the webinar, and there's also, it's also taped. So this also shows you technology tools and the resources that are available on that. I know I'm rushing, but you know, you're getting the idea. Like I said, I'm like a directional person. I'm the cross guard. You know, I'm helping everyone kind of get to the things that you need to, so in your homes you can really be able to access. This is going to be a free webinar coming up with the famous Dr. Metcalf, who's solution focused, wrote 11 books on solution focused counseling. And so she will be presenting for us on April 22nd on solution focused types of things you can do online. So, and moving on, we also do kind of a happy hour. We try to have ways for us to connect. We know that it was talked about earlier about self-care, And we think self-care is also letting our hair down, just talking to each other and connecting and supporting each other. So we're also doing that right now. And I think I'm getting close to the end. I just have to say legislation and advocacy are really interesting, and moving on to the next one. After that, we have online interactive maps for you. We were working very hard, and this probably will take a whole webinar to really point you into these kinds of directions. But these are tools, and if you can just skip to the next page, Jeremiah, you'll see that we have divided ratios, counselors, nurses, school psychologists, school social workers, like we've never been able to disaggregate before by our legislative districts. So if you can see that if you just click on, and this is going to be available for you, you can see what kind of ratios are in that particular area. If you click to the next one, just an example of Senator Bradford's in the Los Angeles area, but it shows you kind of his voting records. This was by the ACLU, and then it shows you the ratios. And so it's an advocacy tool that you can use to talk to your legislators about where you stand in comparison to other areas. And then moving on to the next one, which is by school district. So you can look at your school district and the surrounding school districts to see how you compare. What I love about this, if you look at down at Alameda Unified School District, you'll see that they have reduced their school counselor ratios by 113% over the past 3 years. And you can see they have actually improved across the board, except for social workers, in regards to their ratio. So it's a nice little map that really shows you what's going on in the counseling world and gives you an ability to advocate. And then if you go to the next one for me, please, which is a bill that's been suspended, but it's Senator Wilkes is out of the Santa Clarita area, and in his district was where we had the last school shooting, tragically, in the William Hart School District. And so we're working on legislation to actually provide for not only for school shootings, having mental health services afterwards, but also for natural disasters. They're going to still work with us, but right now we're expecting about the majority of the bills are not going to go through this year. And even the Senate and Assembly Education Committee chairs said the last few days that they're only going to hear bills that have to do with COVID-19. So that's where we are. Doesn't mean that these are gone forever, but it just means that these are these ideas that we've been floating out there, and we had a lot of traction, and we're going to continue to work with different key decision makers in our state to get to the things that we know that are important. And I think that I just have the pictures of all the board. I'm going to stop there, but that's the board. Just thanking all the all you folks for doing this hard work together. We're all in it together. We're all here to help, and keep it up. Thank you very much.
Loretta, thank you very much. There is a lot of resources in there, a lot of links, upcoming webinars that the attendees are going to be able to be a part of and really get resourced to be able to better support their students. Monica, I'm so glad you're here and still a part of things. We're actually going to go until about 5 minutes after 3. Hope you can all stay here with us, have about 15 minutes for Q&A. But we're getting quite a few questions and even some comments that people have been really thankful that Superintendent Thurmond was able to be with us. But really the curiosity, it seems like the running theme is what else, or could you go into a little bit more detail on what the CDE is doing? I think you rushed together a PowerPoint and sent it over to me, so I can share my screen. You can kind of walk through that. I think that'd be really helpful to share what all CDE is doing and then planning to do moving forward to support our educators across the state.
Absolutely, I'm happy to do so. So I'm gonna again share, a bird's eye view of quickly so that we can highlight some of our partnerships. And I believe this is, really useful information because many times there's a disconnect between what's happening in the field and at the local level and what we're doing at the state level. And I want to also highlight that there are opportunities for all of you to be involved in some of these statewide activities. So if we can advance. I work for the mental health services program that's under the Department of Education. And so really what we're here for is to support you with information and opportunities for professional development. And although this is not on here, I would be remiss if I didn't mention my colleague Hilva Chan, who works alongside me, supporting me with some of the mental health aspects of our program. She focuses on California Healthy Kids surveys and also is the director for the project CalWell and CalStop. Okay, you can access our information, go to the link there, and you can get more information on that. Next slide, please. We've just created a new crisis webpage. This webpage contains helpful information on crisis resources. And if you see that button there, anybody who is in a crisis, or really what we want to share is that any suicide prevention crisis line, hotline, warm line, you don't have to be in immediate crisis. You can, be experiencing a bad day and just need somebody to talk to. So that, if you click on that one, it'll take you directly to the chat line. And again, you will see the URL down at the bottom so that you could access this crisis webpage. Okay, next thing. So the Student Mental Health Policy Work Group, really the overall goal is to look at what's happening in the landscape of student mental health throughout California, and to make policy recommendations to the State Superintendent of Public Instruction that's going to favorably impact student mental health and build capacity among K-12 schools, mental health providers, and other partners. And so this group was convened in 2012, and we're still going very strong. We have about 50 members, all volunteers whose programs, interests, and activities align with and intersect with student mental health. Some of our partners, just to mention a few, are Blue Shield of California, of course, Wellness Together, American Foundation for Suicide Prevention, California Association of School Psychologists, Kaiser Permanente, Directing Change, NAMI California, and some school districts, including ABC, Montebello, Orange County Department of Ed, Placer County, and San Diego County Office of Ed, and many, many more. Next slide, please. These next two slides are really some of just an overview of the policy recommendations that have been approved by our former superintendent. I'm not going to go into each of them, it'll take too much time, but I do want to call your attention to that very first recommendation, which I think is a legacy piece. We made the recommendation to include mental health curriculum into both the administrative and teacher credentialing standards. The California Commission on Teacher Credentialing approved the integration of mental health into their admin credential program, but it was not approved for the teacher credentialing program. However, we believe that that is a great stride, and we're going to continue to advocate for the integration of mental health into the teacher standards, and hopefully the next time they are reviewed, we'll be able to do this. You can skip on to the next one. Those are additional policies recommendations that have been made. And there are also 5 more recommendations that have been made by the group that are currently in the CDE approval process. So we're looking forward to hearing soon about the status. If you want to go to the next one, our next meetings are May 22nd, which that's going to be, usually they're in person from 10 to 4 at the Sierra Health Foundation. But this one, because of our current situation, is going to be virtual, and likely the one in August as well. We're just going to play it by ear. But we welcome the public, and we will be sending out information to the field, and hopefully Wellness Together can also share that on their listserv. Next slide. One of the biggest programs that we have is Youth Mental Health First Aid. It's part of the Project CalWell program. It's an 8-hour training. It is completely free to the hosts. We received original funding from SAMHSA as part of Project CalWell, and then Blue Shield of California. I just want to really give them kudos and thanks for all of their help, because they have also given us $250,000 to expand the reach of YMHFA. So if you're interested, you can send an email to, and I don't think it's on there, but it's ymhfa@cde.ca.gov. We'll give you that. We'll repeat that somehow, or give it to you in the notes. All right, next thing. We partner with the San Diego County Office of Education. They've been doing some excellent work. They were part of our first cohort, Project CalWell, and with that and their experience, they are able to actually establish a wellness office funded with general dollars. They were also the County Office of Education that was selected to be the lead in providing the online suicide prevention program. This is going to be distributed by county offices of education. We're hoping next week. That is our launch. And so the program, it's called Living Work Start, and we will go ahead and share that with folks. There is that graphic on there. I'm sorry, and you're going to get this, but this graphic there, that sheet, is going to complement the information that was provided by Cassie, and it's just, you know, making sure that you are looking for the signs, behavior, and keywords that students are sharing while you're doing check-ins. All right, next page. This is another excellent resource that was created by San Diego County Office of Education. We really want this resource to be shared with students directly. If you see that first flyer on the left-hand side of the screen, those are all active links, and they will take you to exactly where you need to go. On the bottom of the next page, you'll see that there are some icons in there, and you can click on them. One of the ones I recommend that you link onto is GridX, which is a great platform for students to learn how to regulate their behavior and create plans for their wellness and their safety. And you can access that flyer, which will also be included on the bit.ly. You can access it also by that URL on the bottom. All right, keep on going. I'm almost done. Other partnerships, we've partnered with University of Southern California School of Social Work. We've had 2 different activities. The first was a collaborative journey to becoming a trauma responsive school, in which we had over 400 participants. And then from that stemmed a learning collaborative, which was a smaller group of LEAs that are receiving one-on-one individual attention from our experts at USC on really how to, continue moving the needle on becoming a trauma responsive school. Of course, we have the partnership with Wellness Together to bring you the annual Student Wellness Conference, and then also webinars in addition to this webinar series. And with Directing Change, we promote their student video contest, and they are critical partners in our Suicide Prevention Committee. Next, please. We also collaborate with the NAMI California to bring NAMI on campus high school workshops, and really this is the student-led club at school, and it really promotes the voices of students, and it's to increase awareness of mental wellness as well as reduce the stigma that's associated with mental illness. So that's another partnership. And then our last one is a guide that we developed in collaboration with Placer County Office of Education. This is still available. I have copies of it. It's based on the Minnesota Associations for Children's Mental Health. And what we did was we took that and made it California specific to all of our resources, our different populations. And it really is a guide that people can use, and anybody on the school staff can use this to get really good information. What I like is not only does it give you some of the signs and symptoms of behavioral health issues, but it also gives you very strategic or strategies to work with the students. And with that, I don't know, I think I went over my 4 minutes, Jeremiah.
No, that was great. I don't envy your inbox. that there's going to be a lot of things. But please, I would encourage attendees, check out the resource folder. Monica will make sure that the team uploads this presentation into the resource folder here by the end of the day. And thank you so much for sharing all those great partnerships and programs that are being offered. And especially excited about the online suicide prevention training that's still going to be launched, even in light of the challenging times right now. So thank you for sharing. We certainly appreciate it, and all that CDE is doing to support us all as we are supporting students and families across the state. So the next question actually goes out to Marlon. Marlon, there's been several that have chimed in that have essentially said, hey, could you please repeat those 5 S's? I only got 4 of them. I think you had a 6th one this time too. So would you mind sharing those 5 S's that is really having an impact on our health and our students' mental health?
Sure, I'd be happy to. So the first S is sleeplessness. A lot of our students are getting less sleep than ever before. That might be a great question if you are going to do a check-in with students about how they're doing at home. You might want to say, hey, how's your sleep been? Have you been getting enough sleep? The second S is screen time over authentic communication. So you may want to ask a student, hey, do you have anyone at home or that you're isolating with that you can have a face-to-face conversation with? The third and fourth are solitary and sedentary lifestyle. Those can obviously affect our mental health and have a negative impact. And then the 5th was self-medication. So the 6th one that's been added for the webinars and for what we're working on here is to mitigate the effects of that 6th S, which is social isolation. So thank you. As a former school counselor, I loved all the information presented here today. I believe it's going to be very helpful. And so thank you to all the presenters.
Great, thank you. I think we have time just for one more question. And Cassie, this goes to you. There's been a question here that I think would apply to quite a few of us here still on, and that is, what are some additional considerations to take into account when we are helping populations who are facing poverty and homelessness? For students who may carry shame due to their social, emotional status, how do we avoid worsening their feelings of shame? Would you mind speaking to that question just for a couple minutes as we end our time today?
Hi guys. Yeah, thanks Jeremiah. That's such a good that was such a good question and really a thoughtful one also. I think one of the things that came to mind for me was just some training that we've had in utilizing some TheraPlay strategies. Well, let me just back up. So I think absolutely the idea behind connecting with kiddos is not to make them feel bad, right? And also to remember that they are not their circumstances. And so however you can sort of digest that and make sure that that comes out very authentically is sort of my best advice to you. Just to remember that they are not their circumstances. Also, in the context of, I think this question might have come up in the context of checking in with folks and asking kiddos to kind of share their space and take you on a tour, and that they might feel a little bit embarrassed by that. I think that that is a really appropriate boundary just to sort of be aware of. And I think what you can do in that case is just to really capitalize on the student. So how are, I can see that you brought your eyes to our meeting today, and that you can totally see all the things that are going on around you, just to kind of create sort of a levity to the situation. But things that sort of acknowledge who they are, why they are special. For little kids, this works really well. In like TheraPlay, we sort of do like, oh, I can see your nose, and oop, did you hear that sound your nose makes? Just to really help address, just to identify that you see them. You don't need to know that you acknowledge that they are not their circumstances. I hope that makes sense. That's really my best advice in terms of addressing the shame. It's not important that we necessarily, have them run around and show us all of the things that might make them nervous, but that might come in a later phone call. And so just making sure that you continue to check in. And like I said, just remembering that they are not their circumstances. They are a person. They are worthy of your attention if they show you nothing, if they do nothing. And that they are good. They're good enough just the way they are.
Excellent. Thank you, Cassie. Sure appreciate that very thoughtful answer and approach to be there with students. They are not their circumstances. You're absolutely right. Thank you. You know what? We were going to kind of end about now, but there's still quite a few people that are still on. So if there's still questions rolling in, so I'm going to direct this one to the team at USC School of Social Work. For Pamela and Vivian. This question came through, and if you wouldn't mind just taking a moment just to share your insights on this. And this person asked, when we eventually return to campuses, and well, won't put a timestamp on that, right? But when this does happen, what steps should we take to ensure success at the reconstruction phase of working through that? And what are a few ways we can start working on that process right now?
Do you want me to take it first, Valerie? We usually answer in tandem. I think one of the first steps, and I think, in terms of manageability, is really understanding what do you have right now? What is your safety plan, school safety plan, and how has your school itself has interpreted that or converted that to a local one? And I think part of the conversation, since if you guys are still meeting, if the administrators are still meeting and educators have representatives and your support services staff are part of that too, is looking at what do you have right now, what is in existence, and also looking at how are we going to plan to use this when we all return. And if you don't have one, I think this is a really good time to kind of start thinking about it and utilizing some of the resources that we've sent you in terms of what is your return to school plan and how are you going to continue supporting each other as well as the students and the families that are coming in. It's so hard to really answer that in the amount of time that we have, like this few seconds, but understanding what you have and really kind of maybe divvying up the work and looking at what are the gaps, because everybody's going to have a different gaps. You have your educators, your paraprofessionals, and you're going to have your support services staff. So that's going to mean so differently. So then I think this is time to kind of have that discussion if you don't have one. Pamela, is there anything that you would like to add?
Well, I think you have so much expertise around the building infrastructure piece. The only thing I wanted to emphasize a little bit more, because I really right now I want to be focusing on the educators themselves and bringing all of our school staff to a state of physical and psychological resilience and wellness.
Yes.
And so I did quickly share one resource. Would it be okay if I shared my screen?
Sure.
Okay, great. And then I'll just show you right here. This is a new online curriculum for educators. It's called Support for Teachers Affected by Trauma, or the website address is statprogram.org. And this is a online curriculum. It's free of charge, and it's really designed to help educators understand the basics of trauma, but also the impact that working with trauma-exposed youth can have and strategies for enhancing our wellness and well-being. So I encourage you all to go to this website and let us know if you have any questions, but it's here for you, and we really want you to use it and as a resource for you.
Great, thank you. And I have a question that Cassie, I would ask you maybe to take the lead on, and then I think our other panelists would be good to add maybe their perspective on it. So again, Cassie, if you wouldn't mind sharing first, and then we'll have the rest of the panelists kind of add in what their perspective if that is helpful. So in terms of getting our eyes on students, like physically being able to see them, I love what you said, like being able to actually see them, not what's around them, right? So getting students on our radar to make sure they're doing well and they're healthy. What if they don't have Wi-Fi? They don't have a smart device. They don't have maybe even access to a telephone that other families might have. What are some other ways, in light of everything that's happening with COVID-19, what are some other ways that we can make sure they're okay if we can't actually get our visual eyes on them?
Yeah, Jeremiah, I'm so glad that we made time for this question. And I am so curious to hear what others' recommendations will be as well. But one of the things that I was thinking about when I saw this question come through was, again, first of all, it's a really good point and a really thoughtful consideration for many of the families that we work with. But there might be, so two things is, one, you might be able to put together assignments that is part of your distance learning package, address some of these same challenges. So putting together sort of open-ended writing assignments or things like that, that you might be able to sort of tailor around some of those prompts that we went over before, things that sort of help you assess how the family is doing, how the child is doing, how they're navigating this really difficult time. Art projects, same. You could sort of build it into some of your distance learning material potentially. The other thing is that I think if you are on social media, you've seen so many wonderful, uplifting images of teachers going to houses, staying physically distant still, but just dropping off materials, giving a wave through the window, leaving materials behind. In fact, the other day I had seen this really beautiful picture of a teacher whose kiddo, she had learned that one of her students was really missing her, and so she took time just to come and read a story in her driveway. Again, still with the physical distancing in place, but still was able to create that connection and still do that kind of check-in. So either by way of building it in as an assignment, something that gets turned into you, or taking opportunities to go and visit, if that is a possibility for you, would be two suggestions that I would have off the cuff for this question.
Great, thank you. Any other panelists that would share? Monica, great, thanks.
Yeah, so it's interesting that you say this. We just talked to a school district yesterday that has about 16,000 students, and it's one of the smaller districts, but what they did is they were able to divide all of the students and had everybody take on a couple of students and check in with them, and there were about 20 or so students that they couldn't get a hold of. And so when they were giving out Chromebooks, I guess there's a way that you can you have some kind of tracking device on the Chromebooks, which is smart, but then also kind of a little scary. But at any rate, this was helpful to the district in that they were able to locate one of their homeless youth into a different city. And so they traveled all the way over there just to make sure that she was safe. And this is an example of going above and beyond, right? So when you can't physically or virtually connect with students. And then I don't know how many of you have heard of that heartwarming story about that. I don't remember if it's a teacher or an administrator in the UK who walks 5 miles every day to make sure that he is feeding his students. So he delivers 78 lunches every day. Again, not asking you guys to do this, but this is an example of connecting with students who don't necessarily have the resources and the technology to connect with. So there's lots of different ways, and social workers, psychologists, counselors, all have that ability to do it. And if you don't feel secure in doing that, reach out to a colleague or reach out to us to see what other ideas and what other support we can offer you, because we're here to help.
Hi, this is Vivian Villaverde, and I know I'm more on the infrastructure building too. this might be a good idea to reach out to your IT supports in the district level and see if they could maybe come up with a flyer that you can send to their homes, or you can share with the students. I don't know if this is a possibility at all, but there's a bunch of different companies that are offering free Wi-Fi. So if they might have the device, they might have the phone, but they might not have the capability because of no internet, but this is a way to do that. So maybe aggregating all that information, it's just, just having your IT that could do this for your district so that they can share it to the parents. I don't know, that's one thing you could do. Google is doing it, Charter is doing it, Spectrum is doing it, and some of the other carriers are doing it as well. So I think with all of them combined, even the more remote areas, they might be able to get that Wi-Fi access, even if it's just using the phone. That might be a way to connect with you. I don't know if that's helpful at all, I hope.
No, that's great, Vivian. Thank you for speaking to the macro level for there. And I think what's great about today's webinar too, I can turn my camera on, is just to have both kind of a big picture, kind of statewide kind of view, what's happening in terms of systems and structures that can help us all the way to a county or to a site or even individual community level of how we can help support our students and families and even support ourselves during this time. So thank you so much for being with us. Let me real quick just share my screen once again, and we'll get everyone's favorite links here. And feel free to take a look at the resources here in a little bit. Our team will take some of these presentations that we didn't have beforehand, and we'll upload those at bit.ly/supporting supporting students. When you go to that link, there's going to be 3 folders. There's going to be an April 9, April 16, and April 23rd. You go into that folder and you'll see the respective presenters in there with their resources in there. So make sure you take a look at that, and our team will be uploading the additional resources we talked about today, and also a Google Doc with some of these links. I know Monica had mentioned a few things that maybe weren't in the last presentation she shared. We'll put that on a helpful link for you. Feedback, wellnesstogether.org/feedback. We know you're busy. You likely have many more responsibilities besides attending a 2-hour webinar today. But if you do have some time, we'd love to hear how we can make this experience better and more helpful for you. I'm going into week 3 next week on the 23rd. And then if any other questions you have for panelists, actually each panelist is seeing those. So if you do have those, we can send those to there. And I'm trying to still establish a way to have a kind of close the loop in communication to be able to best support you, because there's some great questions going through. Thank you to everyone who was engaged that way and visited the link. And finally, be on the lookout before next Thursday for the recording for this presentation at our YouTube channel. Again, just go to YouTube, type in Wellness Together and subscribe. That's the quickest way to get all of the content. And if you're not really a YouTube person, you can just go to our website, wellnesstogether.org/events. It'll be up on there. And so for all of us here at Wellness Together, School Mental Health, and on behalf of our great partner in this effort, the California Department of Education, once again, my name is Jeremiah Aha. I'm so glad you were able to join us today. Thank you, take care, stay safe. You are the best intervention for your students. So take good care of yourself. Until next time, next Thursday, 1 p.m. Pacific, and we'll see you then. Take care. Bye-bye.